Hello, this is Dr. David Greene, CEO of the Mid-Atlantic Pain Network. Today's topic is what are the best treatment options for spinal stenosis? Spinal stenosis involves a narrowing of the spinal canal with pinching of nerve roots, typically due to bony and soft tissue overgrowth from arthritis. You can actually see it here a little bit. You have the disc space here, and then coming back you have the spinal canal, but you get this overgrowth from either what they call a hard disc tissue or these bony joints in the back overgrow with soft tissue and bone, and it ends up pinching in the canal on various nerve roots. Usually it occurs in patients who are over the age of 50, and it's often seen at multiple levels. It's typically not symmetric. So here's what you see. You have a normal spinal canal here, which is wide open, and then you start getting this overgrowth of bone from the facet joint arthritis here and here. So it starts to pinch, and then you can get some disc bulging, and they call it hard disc as it calcifies, and that can pinch as well. So the symptoms include typically an aching pain in the buttock and leg on the affected side, and may have symptoms of sciatica. In unusual cases, it can lead to leg weakness. It actually can overlap and be mistaken for a hip joint problem. It's typically position related, so leaning forward makes it feel better as it frees up the nerve roots, as it opens up the canal. So out of a textbook, you see a picture of a person leaning forward on a shopping cart, and that's because someone will often say, I feel better when I'm in the grocery store leaning forward on a shopping cart. And then as they walk, say for instance, downstairs, they're leaning back to maintain balance, and that closes down the spinal canal. So that can be an issue. Now, you have to distinguish between neurogenic claudication, which is spinal stenosis, and vascular claudication, which is obviously a vascular issue, okay? So here's a classic example. Someone says, I walk 30 yards and I start to have cramping in my calves. And it starts to go up my leg from there. And then when I stop and sit on the bench, it goes away within 30 seconds or whatever. That's typically vascular claudication. It comes on after a defined time period of walking. It starts in the calves, and then it goes away after a defined period of sitting. Neurogenic claudication is different. Typically, it's more position related. It does bother people with walking, but it usually doesn't start in the calves. It usually starts in the buttock and goes down. In reality, most people who have spinal stenosis don't have actually any symptoms. It just shows up on an MRI, but they don't actually hurt at all. So the treatment options, first and foremost, over-the-counter anti-inflammatories and Tylenol. Neurontin and Lyrica have been shown to have benefit. They call them neurogenic modifying medications. Physical therapy, spinal decompression therapy can help. Epidural steroid injections have been a gold standard for spinal stenosis for decades, and they can work exceptionally well for weeks to months. Whether or not to have surgery for spinal stenosis is truly a quality of life decision. It's not a deadly phenomenon. It's not going to make you bedridden, but it can really put a damper on someone's quality of life, and you should only make the decision to have surgery after considerable conservative treatments have failed. Now, a lumbar laminectomy is the procedure of choice when you have stenosis, and it usually has a pretty good outcome. The procedure itself would be where you take this bone off the back of the spine to free up the nerve roots that are being pinched in spinal stenosis. If you're just having right-sided symptoms, it might be that you only need the right side taken off. Or if you're having bilateral symptoms, it might be that you need, the full procedure. It may be that the surgeon needs to add a fusion to the procedure if you're having a lot of back pain. But all in all, if you just have a laminectomy, it's a fairly low-risk procedure. Half of patients do end up with some back stiffness after surgery. There is a chance that these nerve roots could end up with some scarring, and that's called post-laminectomy syndrome and can lead to a lot of pain. The bottom line is that surgery can be avoided over 90% of the time. Epidural injections can be repeated every few months, and it truly is a quality of life decision as to whether or not to have surgery. When you do add a spinal fusion, it does add a whole level of complexity to the procedure that may or may not be indicated. The top non-operative pain management in the Mid-Atlantic region is through the Mid-Atlantic Pain Network. There are many clinics in the network accepting over 50 insurances and providing over 25 treatment options with the board-certified doctors. Visit us online today at midatlanticpainnetwork.com and then call us for scheduling at 855-444-6585. I'm Dr. David Greene with the Mid-Atlantic Pain Network. Your pain stops here.